Hi, I'm Dr. Neil Gordon, and this is another in the series on setting the record straight, the truth behind your questions.
How do I choose a doctor, and is plastic surgery safe?
Considering that facial plastic surgery is elective and anything involving our face must be accomplished time and time again without issues, ensuring competence and safety is not difficult today, and this discussion should provide the necessary information to make everyone comfortable that they're starting the process appropriately. In choosing a doctor, the key is understanding what you want and how the physician is trained. Today, there are many different types of doctors that perform cosmetic procedures. Understanding the formula that creates the doctor will allow us to understand what they would be appropriate and good at versus what doesn't make sense. There are two main types of plastic surgeons: facial plastic surgeons and general plastic surgeons. Understanding their training or the formula that creates them will allow us to understand where their expertise is. There are two main aspects of training after medical school for all doctors: residency, which is the lengthy period of time of training, and fellowship, which is where final specialization occurs. For a facial plastic surgeon, the majority of their training, their residency, is in otolaryngology, head and neck surgery, which is all the medical and surgical problems of the head and neck. They then do a fellowship, which is the final specialization in facial plastic and reconstructive surgery, which is all of the cosmetic and reconstructive issues involving the same region. So discussing a tummy tuck with a facial plastic surgeon clearly is illogical. In contrast, a general plastic surgeon completes their residency in general surgery. General surgery today is all aspects of abdominal surgery and breast surgery. They then do a fellowship in plastic surgery of the entire body, and this encompasses handwork, burns, cosmetic work of the body, as well as the face. So clearly, these doctors' expertise will be in all the procedures of body and breast work. Today, dermatologists offer many cosmetic procedures. Their training is in the medical field of dermatology, which makes them the experts on the skin. Because multiple specialties can all offer treatments to the same region of the face, it's important to understand the differences in their training, because this is going to dictate for you who's going to be the best person to accomplish your goals. Once you're comfortable that your doctor is trained appropriately, you should see that they're board certified. It's important to understand that the different specialties of expertise have different boards that they're board certified in. So one board is not necessarily superior over another, but your doctor should be board certified in the specific specialty that they trained. The reason for this discussion is because of the amount of marketing that is done in this field, that sources such as the internet, magazine articles, and even best doctor lists are not foolproof sources of information today. Once we get to this point, the bottom line is, if you see their results and you like what you see, that's what you're going to get. If you don't like what you see, that's what you're going to get. Because what we do is elective, everyone should be confident that their procedures can be accomplished safely. As chairman on the Committee on Patient Safety and Accreditation for the American Academy of Facial Plastic and Reconstructive Surgery, I take this topic very seriously, and I want to share these simple steps that will ensure that you can have your procedure done in an appropriate environment. The first step is knowing whether the facility you're considering is accredited. Accreditation is mandatory by both the Facial Plastic Surgery Society, the American Academy of Facial Plastic and Reconstructive Surgeons, and the General Plastic Surgery Society, the American Society of Plastic and Reconstructive Surgeons. And this ensures a number of things. One, that your doctor is board certified. Two, that the type of procedures that they're doing in that facility, they're appropriately trained for and has been reviewed. In addition, it also ensures that the facility you're at has all the proper equipment, protocols, and personnel for safety and emergencies. So, if the facility that you're considering is accredited, This is similar to the Good Housekeeping seal of approval. This is Dr. Neil Gordon, and this was another episode of Setting the Record Straight, the truth behind your questions.